Okay, so I'm going to do a quick session on One Wales What's New. So in terms of the policy, last year we really tried to look at putting in some updates to the policy, and that was driven principally by a few issues that we had with the policy in terms of defining some of the terms, making sure that we have an understanding over our commercial access arrangements, and also ensuring that we had an equality and health impact assessment completed for it. But also one of the things was around sort of our terminology with regards to commissioning, because One Wales isn't routinely funded, and OWTTC is not a commissioning group in itself. We felt that this was a term that was perhaps less suitable for One Wales, so we have dropped the commissioning part of the wording. Interim still remains because the idea of One Wales is it's interim to other medicines becoming available, either via the HTA route, either that medicine becoming licensed and then going through the HTA route. So the idea then is that things don't necessarily sit within One Wales, but at the same time we recognise that there are some medicines that just have a niche, they won't get licensed and are useful to have available through this process. So there is less sort of emphasis on the interim, but it is still there. To make it clear, because there are lots of One Wales products out there at the moment, we've used the term now One Wales medicines, just to be clear that it is to do with medicines. We've tried to define a bit more clearly routinely available, and that's really in the context of when we're considering unlicensed or off-label medicines. And the rationale for that is that with these kinds of products, what we would like to do is obviously use a licensed product where available, but if it hasn't been through the health technology appraisal route, so there isn't routinely available, then there may be other options here, unlicensed medicines. Generally we don't cover, but off-label particularly we use through this process. So it was just to put a bit more context around that. As I say, we've removed the emphasis on commissioning, and because of the changes to removing commissioning, we've renamed this group to the One Wales Medicines Assessment Group. So you're now going to be known as OWMAG. So if you hear that term, it'll take a little bit of get used to, but we think it was a bit more representative of the group. We've put some greater detail around commercial access arrangements and terminology for that. So if you have any questions about that, please do come back to us. It may be something that we won't be necessarily able to answer immediately for you, but we will consult with our colleagues who have been involved quite heavily in helping us with that part of the policy. We completed an equality and health impact assessment, and then for any new medicines that go through the process, we have to complete an update to that assessment, just to make sure that we're treating everybody obviously fairly. We put some other key policies in there to make sure that we were aligned, and probably the main change for you as a group really is to do with the expansion of the review period up to 3 years. So initially what we're going to do with the reviews is that we're still going to do a 12-month assessment after the first a 12-month review, after the first assessment, because we feel that that's important. It allows us to gather some data around how many patients are actually receiving the treatment, get a feel for activity of use, side effects and efficacy. But what we want to do is give this group the chance to extend that review period up to 3 years, so it can be anywhere between 12 months to 3 years, and that will be decided at the review stage. So there are some medicines that you will be reviewing this week, so as part of that slip, that voting slip now, there'll be an extra column to say whether you want to review that at 12 months, 2 years or 3 years, you can sort of decide where you want that to be. And the reason for that really is that for some medicines, they are going to stay on our books for a while. The information isn't changing particularly quickly, and we feel that it's perhaps a better use of your time if we use it for new assessments or ones where we need to make those decisions a little bit more quickly. But obviously, to make sure that we are still keeping abreast of the information that's coming available, we will do an internal annual review within AWTTC. So we'll do a literature search. We'll look at what's happening in the world of HTA for that medicine indication, and we may also still request outcome data depending on the situation. It may be just getting patient numbers or something like that, but we may still request that information. If there is any significant new information in relation to safety, efficacy, major change in cost, comparators, there's some health technology appraisal advice that we need to be aware of, then that can trigger a request for an earlier review. So what we'll do is send that to steering committee, AWMG steering committee, and then trigger that as a review to come back to you and ask you to look at that information a bit earlier. Okay, so those are sort of the changes to the policy. I mentioned before that as part of the membership 4-year membership review of some of our sort of older members of the group, we asked for information on what they thought about the group, and they provided some feedback. And some of the issues that were raised were things like raising the profile of the group, looking at horizon scanning and the work programme and how we can better introduce that to you. One of the things was about the meeting itself and you being able to submit questions prior to the meeting, which we have included within our emails now. So, feel free to do that. That's really helpful for us. If we get that information up front, we can try and look for the answers to that and then come back at the meeting a little bit more informed. We were asked to look at the members, sort of a bit more information on the role definition, do some skill set appraisal, and also to think about how we locally feedback. So these are things that we're going to be looking at over the year. And one of the other issues that came up was about training, and that's why we're having this session today, as mentioned before. But overall, the feedback was really great and really encouraging and very useful. So we'll keep that as part of the membership review going forward. One final thing, we had 3 posters submitted to the HTAI 2021 virtual annual conference this year. We did those 3 were on One Wales. We did one on just looking at really about the One Wales process to begin with and its impact. We did a poster on implementation of our recommendations through formularies at health board level, and then one on the work that we did with the oral prostate cancer medicines and that sort of expedited process we did at the beginning of COVID.